I'm going to call the meeting to order. And if we could all stand and rise for the Pledge of Allegiance and the Texas Pledge. Then we'll move on to item number 6, discussion and action to approve the formation of an ad hoc healthcare committee to add a healthcare component to South Padre Island. Darla.
Hello, good evening. This is Darla LaPere with the EDC. As you know, the EDC has been working on bringing a hospital to the island. We did a feasibility study last fiscal year, and we're in the middle of a community health needs assessment. So the EDC board at our December meeting unanimously approved asking you all to form an ad hoc hospital, healthcare. Wait, what are we calling it? Ad hoc healthcare committee. Now, I don't know the rules of how you form that, but...
Well, since it's ad hoc,
an ordinance
since it's ad hoc, it doesn't require ordinance or a resolution.
Okay.
And I think the purpose of this committee is to put together a group of people that are in the healthcare world industry to come up with some sort of roadmap to work towards what the island's needs are. That's correct, right?
Yeah, I think it's to look at the different options of what the product would look like, and then also how to bring it to fruition. What's some creative funding out
what's
there.
What's needed and how to do it.
Right.
Okay.
I mean, we are doing the opportunity zone, setting that up,
right.
I think, and Dr. Joe wants to talk a little bit. But I think it would be helpful if we had a committee just really working on that.
Well, I think that a committee that's focused on this issue is the best way to proceed at this time for the community. So I would agree with that. And
the EDC did, in the motion, ask that Beverly and I be on it. Squash, she's in the healthcare industry. And then I think, I'm not speaking, but Rodrigo might be helpful.
Okay.
My opinion.
All right.
Yeah. And then, is it okay if Dr. Joe says a few things? Go ahead, Dr. Joe.
Thank you. And for those of you who don't know me, I'm Dr. Joe Ibarra. I'm a board-certified emergency physician and board-certified family physician, a couple of other boards that don't matter, like forensic medicine and stuff. But I've lived on the island since 1994. I was recruited at Valley Regional by David Butler, and I brought a group of ER docs, and we staffed the ER. At the same time, we helped out with the clinic that was on the island that Brent Coleman ran, and then Rochelle Owens. That lasted till right before the bridge collapsed. And then a year after that, I brought Valley Baptist, and we built a family practice clinic at 3401 Padre, which lasted about 3 years and then got taken over by some private doctors. They closed it down. So currently, there's not really a legitimate healthcare facility on the island. So I've been racking my brain. I mean, I live on the island. I care about the healthcare on the island. So fortunately, some things have happened. Some unfortunate. I've had some health issues that are kind of making me work less ER. And so I'm going to be full-time on the island as a primary provider. And I'm also facilitating the acquisition of the land. Well, I have the land across from the fire station, and I've just sold it. We have a contract with the hospital development company that I've formed. And so using opportunity zone funds, which we have a big war chest now, and the mayor met kind of the individual that put this together. It's an opportunity zone fund by physicians, and they wanted a fund to do something medical. So I met them, and they're going to do a hospital on the island. And they're also going to fund the startup of an urgent care / primary care at 3401 Padre, which I've re-obtained. And so we're going to have health care on the island. However, what I've learned in the first round in 2000 when the bridge collapsed, that if there's not a partnership with the city, it doesn't really work well. So that's why it's very important to me that the city be involved in every stage of this so we can have population health improvement. And that means, looking at what's on the island, how many diabetics, hypertensives, other chronic diseases, substance abuse, alcohol abuse, things like that. So we can with the community health needs assessment that we've done now, or we're in the process of doing, and we have a baseline, in 3 years, how will that look after we introduce robust health care? The 3 hospital systems have not decided to come to our island for whatever fiscal reasons they have. They're all for profit. But I think we can do it ourselves and we can self-sustain. So I'm very excited that we're going to do this. I want everybody on the island to not have to go to Brownsville or Harlingen to get primary care. And I also want to bring specialists in on certain days of the week. When we do have the hospital, our EMS will not have to go, other places. They can stay on the island. All the financial things that go off the island can stay on the island, and we can be self-supporting. So I'm very excited about this. Thank you, Mayor and City Council, for facilitating this whole thing. Y'all have been involved the whole process. So, and especially the EDC, thank you. So I'm open for any questions or comments.
I think this is how the roadmap starts to work on island feasibility or putting together a plan to try to bring health care to the island, and this is the next step. And I don't know, do any of the board members council members have any further questions? All right, hearing none, is there someone who'd like to make a motion?
I'll make a motion to approve the formation of the ad hoc committee for healthcare.
Do we have a second?
I'll second.
Okay.
Discussion?
Any further discussion?
Yes. The council's going to set up an ad hoc, or is it going to be the EDC?
No, the council.
The council.
The council will
Okay.
set it up.
All right.
Okay.
And I volunteer also to be on the committee and chair it, or just be a member, whatever, however I can serve. Okay.
So would
Any
you?
further? Well, we can give Darla direction.
Right.
Susan can give Darla direction on how to obtain the applications, and
Got
then
it.
we'll form it through that process. If it passes here, haven't had a vote on it yet. So, any more discussion? Hearing none, all in favor, please say aye. Aye. Opposed? All right, motion carries.
Okay, I'll get
Thank
with
you.
Susan. Thank you.
Thanks, Darla.
All right,
Dr. Joe.
now we're